Transplanting hepatitis C positive kidney. Organ transplant. Definition. Organ transplantation is a medical procedure in which an organ is removed from one body and placed in the body of a recipient to replace a damaged or missing organ. The donor and recipient may be at the same location, or organs may be transferred from a donor site to another location. Organs and/or tissues that are transplanted within the same person's body are called allograft. Transplants that are recently performed between two subjects of the same species are called allograft. Allograft can either be from a living or cadaveric source. Type of transplant: autograft, allograft, and allotransplantation, isograft, xenograft, and xenotransplantation, dominant transplants. Type of donor: living donor. In living donors, the donor remains alive and donates a renewable tissue, cell, or fluid, or donates an organ or part of an organ in which the remaining organ can regenerate or take on the workload of the rest of the organ. Deceased donor. Deceased donors are people who have been declared brain dead and whose organs are kept viable by ventilators or other mechanical mechanisms until they can be excised for transplantation. Apart from brain dead donors who have formed the majority of deceased donors for the last 20 years, there is increasing use of donation after circulatory death donors to increase the potential pool of donors as demand for transplants continues to grow. Hepatitis C. Definition: Hepatitis C is an infectious disease caused by the hepatitis C virus that primarily affects the liver. During the initial infection, people often have mild or none symptoms. Occasionally, a fever, dark urine, abdominal pain, and yellow thin skin occurs. The virus persists in the liver in about 75% to 85% of those initially infected. Early on chronic infection typically has no symptoms. Over many years, however, it often leads to liver disease and occasionally cirrhosis. In some cases, those with cirrhosis will develop complications such as liver failure, liver cancer, or esophageal and gastric varices. Transmission can be drug use, healthcare exposure, sexual intercourse, body modification, shared personal items, mother to child transmission. Signs and symptoms: acute infection, chronic infection, extrahepatic complication, occult infection. Applications in medicine. Cause of end-stage kidney disease. Diabetes. These patients have a continually high blood sugar. This high blood sugar can damage the filters in the kidney, leading to long-term kidney damage and finally kidney failure. This is called diabetic nephropathy. High blood pressure or hypertension. This is another common cause of kidney disease and failure. High blood pressure in the tiny blood vessel to the kidney leads to damage and prevents the filtering process from working properly. Blockage in the arteries that bring blood to the kidneys over time called renal artery stenosis is another cause of end-stage renal disease. Another condition is called polycystic kidney disease, which is an inherent condition. There are several large cysts or hollow spaces formed within the kidney that make its normal functioning difficult. There may be congenital problems in development of kidneys. This occurs since before birth and manifested when over 9% of the kidney function is compromised. Disease of the immunity such as systemic lupus erythematosus in which the immune system of the body fails to recognize the kidneys as its own and attacks it thinking it to be a foreign object. Who cannot use a kidney transplant? Those with advanced cancer, those with an active infection, those with liver or heart disease, those with AIDS. Pros and cons of kidney transplant. Pros. Transplanted kidneys work just like normal kidneys. The patient will be able to feel much healthier and even more normal. The patient will have fewer restrictions on diet, so he/she has the chance of improving quality of life. The patient who undergone a kidney transplant won't be needing dialysis anymore. A patient who successfully went through a selection process will have higher chance to live a much longer life. Cons. One of the most unfortunate things about kidney transplant is that the body of the patient who needs a new kidney may reject the new kidney. Thus, one kidney transplant may or may not last for a lifetime. In undergoing kidney transplant, the patient will need to use or take immunosuppressant, which can actually cause some complications. Kidney transplantation is not recommended for those who have severe obesity, heart disease, mental disorders, and chronic illness. Should take anti-rejection medicines the rest of patient's life or the kidney's life. Higher risk for infection from anti-rejection medicines. Issue applied in Ecuador. In the last year, there has been 300 kidney transplant in Ecuador. Every year, this number is increasing. Conclusions. Organ transplantation gives thousands of children and adults each year a renewed chance at living full and active life. However, the need for organs and tissues outweighs their availability. Committing to be an organ donor is a generous decision that can save the life of up to 8 individuals, and even more if a donor can give kidneys and tissues. Almost anyone, regardless of age, race, or gender, can become an organ and tissue donor, and there are no costs to the person's family or estate.